I think it's really it's the patient being in the right situation to actually be assessed for heart failure uh, metrics like having an echo done or going to a cardiologist for palpitations and having other studies done. Um, a lot of folks, especially subjectively, a lot of men, hesitate to go maybe as soon as they should. So it's really a matter of getting that education out to um, the folks, however we can do that, and having them recognize what the uh, symptoms and signs may be related to heart failure. Yeah, again, it comes down to education, I think, more than anything else. And there are many factors associated with compliance or really even those patients that will actually even be willing to take cardiovascular medications. It seems to be more of an issue in lower income communities or countries. Um, and I think there's a stigma related to it in that in certain situations, some of these cardiovascular medications will um, impact the way a man may feel. And for women too, it can, sometimes they'll make you a little slower, a little uh, fatigued. They may also have sexual function impact, which quite often is a primary reason for guys to stop taking medications like that. Well, the cost for heart failure management is dramatic. So the idea is to maintain pump function. So your heart is a pump, and you want to make it work as efficiently as it possibly can. Um, that's the focus. Um, when folks aren't assessed or patients aren't assessed um, in a time where, you know, they're not in heart failure, but they are having signs of it and symptoms of it. There are medications out there that can help with improving cardiac function and reducing fluid overload and things like that. Um, but the primary thing is to get those medications, make that contact, and be compliant with these medications. There's also signs that should be well known for um, recognizing heart failure, especially once you've been diagnosed with it, because heart failure admissions to hospitals are quite expensive, and there are simple things that a patient can review daily at home that'll keep them out of the hospital and save money for healthcare. Well, in the implanted device world, so pacemakers and defibrillators and implanted cardiac monitors, AI is used pretty consistently with most of those patients in that there are certain metrics that the device will track and trend, and those metrics are associated with um, exacerbations of heart failure. So that implanted device world has been kind of dialed in on heart failure management for quite a while. The thing about that is there aren't that many patients with these implanted devices. So as a result, we'll rely on things like um, having the patient weigh themselves every day, checking their pulse. If it's over 85 beats per minute for the day, on average, that's a little bit too fast. They probably have extra fluid. It might be related to heart failure. So there's all those things for patients to know. But what AI is going to bring us very, very soon, and is going to be part of the platform that the company I work with utilizes, is the ability to assess cardiac output or pump function just by simply taking an ECG or an electrocardiogram. So you go to the doctor, you get a 12 lead done, and through that 12 lead, it'll give the doctor an idea of whether, hey, I'm above the threshold where I'm normal, or I'm below that threshold and I should have further evaluation. simple tools like that, and that's truly AI, um, are things we need to deploy, um, everywhere that we're doing these electrocardiograms. So we're going to have it in our platform, but it should be at the hospital where they do 12 leads and anywhere where you might have a electrocardiogram taken. That's the tricky part, because for the implanted device world, that is a workload, and it is something that needs to be managed. A lot of those patients are managed by third parties who have developed software that um, makes that work a little bit more efficient and makes it make sense for them to have as a business. So lots of folks rely on these third parties to manage that, and a lot of that is associated with heart failure. Um, for the external monitors, or the traditional ones that patients wear, a lot of it is just seen during the study, and we're looking for those specific metrics, right, that would let us to believe that, hey, something's going on here. Heart rate's above a certain rate for the daytime, no real variation in heart rate from day and nighttime, things like that. So those are the things we need to focus on, and get clinicians to understand how to use those tools to assure the patients understand um, what's going on related to their health and how to manage it most effectively from the implanted device side, the external device side, and just these simple tools that you can use. And then again, using the AI tools that are coming very, very soon.